when just the opposite is true. An issue as personal as healthcare should be decided as close to home as possible. Compacts date back as far as the Mayflower Compact in 1620, and they've been used as an innovative tool throughout history. Authority for compacts was established in the Constitution, Article 1, Section 10, and more than 200 such agreements have been developed since then. These are voluntary agreements between citizens of states, between groups of citizens acting as states, and between groups of states. And when they're consented by Congress, they have the force of federal law. This compact that we filed today says that the legislatures of member states have the primary responsibility to regulate health care in their respective states, and that by consenting to the compact, Congress agrees that each member state shall have the authority to enact laws that supersede any federal regulation within the states regarding health care. It is important to note that this compact today that we're filing is not health care reform, it is governance reform. With me today is Lieutenant Governor Peter Kinder, as well as the Speaker Tilley and other members of my colleagues, and I would like to ask Lieutenant Governor to make a few comments and the Speaker to make comments, and after that I'll answer any questions.
Thank you, Eric, and my thanks go to all the members standing up here and all the other co-sponsors for this innovative and cutting-edge response to the federal health care challenge that has been thrust on the states. My congratulations also to Senator Nieves and other Senate supporters of the bill who could not make it here today. Representative Burleson is correct. Interstate compacts are not new. They are not new to our state. We have a long history of enacting interstate compacts. When I was in the Senate in the 90s, I remember dealing with some brought to us by Senator Wiggins for the Kansas City area, that is interstate compacts between Kansas and Missouri to facilitate intergovernmental relations and transactions that could not be done any other way than through an interstate compact. But I'm excited about this use of interstate compacts because if there is one message that Missouri voters sent more clearly than any other in 2010, it was the August primary vote on the Health Care Freedom Act. 71% supermajority, carrying all 114 counties, tens of thousands, if not hundreds of thousands of Democrats also voting for the Health Care Freedom Act. Missourians said unambiguously and as clearly as possible, and then they said it again in November, we want health care choices reserved for us. We want the power to make health care choices to devolve from an all-knowing, omniscient federal government that is in the process of fouling it all up. We want those devolved back to the state of Missouri and to individual Missourians to make our own health care choices. That's what today's announcement is about. I'm excited about it and lending whatever support I can to the effort. And now you're going to hear from our Speaker of the House, who's our host.
Well, thank you all for coming here, and Lieutenant Governor, thanks for your leadership on this issue. This has been an issue that you've led on in our state and become a national leader on, so thank you for being here. Representative Burleson, thanks for leading with this issue as well. I mean, I think it's pretty clear, and just to echo the comments by Representative Burleson and Lieutenant Governor Kinder, we believe in the fundamental principle that local people should make local decisions, and that includes decisions based on their health care. 71% of the voters were right in Missouri, and our job as representatives and the voice of the people is to be their voice. And this is a way that we can develop a compact with other states to return the power of running our healthcare system back to the people that it should be with. And so I will tell you that we are going to get the bill referred to a committee. We hope that the committee has open, fair, and transparent hearings on the issue, and it's something that I think overwhelming majority of my caucus, and I believe with bipartisan support, will pass through the House. And we'll be happy to answer any questions.
You say you expect bipartisan support. I don't see any Democrats here.
Well, I mean, you probably, there's a lot of press conferences that you don't see a lot of Democrats are, but my question to you is, when we passed the health care reform resolution, Prop C, you had Republican vote, you had Democratic votes. When we passed the jobs bill, you had Democratic votes. When we passed the TANF bill, you had Democratic votes. I think the best predictor of what's going to happen in the future is what's happened in the past. And so far this session, you've had bipartisan support on issues. And so I really don't see any belief or any reason that will continue.
What's the practical effect of this compact you talked about? If Congress ratifies it and it becomes federal law, but what's the practical effect?
It enables our state to move in a direction that I think is best for Missourians, that we all feel is best for us.
But I mean, is it just a symbol of the fact that you don't like the federal health care law, or will it actually, can it do something?
I think the
Can it become
the
law?
impact is the system that was established, that each state has the authority to do what they think is best. And within that, you have a creative environment where states can try things and we can glean ideas from what works and what doesn't work. What clearly doesn't work is a monopoly style where the federal government decides everything.
So if the compact were to be approved by Congress, it would stop Missouri and the member states from implementing changes under the federal health care bill?
It would not necessarily stop states from doing that. If states wanted to continue, they could.
Then what does it, I'm still trying to figure out, what does it do? What would it do specifically for Missouri if this compact got ratified?
It would specifically establish that current federal and state law is intact, but then Missouri and any other states participating in the compact can move in a direction from there that they see is best for their states and the citizens of their states.
Does it give you complete independence or partial independence within the federal?
Complete independence within the scope of healthcare.
So it removes the sovereignty clause at the federal level on the healthcare issues.
Correct.
What makes you think Congress will approve it?
Well, with the pressure of our state, the citizens of our state, and other member states that are joining in the compact, it's public political pressure.
How many states so far?
So far, we've identified several states that have already moved on legislation, and there's 31 states that are working on it right now.
How many of those states have Democratic majorities?
That's a question I don't know.
How would you, assuming the compact is approved by Congress, how would you convince Missourians that a healthcare plan that was developed by the Missouri General Assembly would ultimately provide better health care